Good morning, everyone. I am Alvin Ayangpa from Davao Oriental State University, a second-year nursing student. And today I'll be discussing about the topic from maternal and child health. These are the three that will be discussed. First is the inlet contraction. Second, the outlet contraction. And the third and the last one is the external cephalic version. Before diving into the topic, let's have a recap about the anatomy of a pelvic bone of a human. The first one is the inlet view. We have the outlet view, AP view, which means has a view from front to back. Lastly is the lateral view of a pelvic, or also known as the side. This is the pelvic bone of male and female. For females, this is gynecoid, which is common for females and the best type of pelvic in terms of labor. So this is the smaller one. The upper part is the inlet, while the lower one is the outlet view. So this is characterized by a spacious and wide pelvic inlet, a broad pubic arch, and spaced ischial spines. For males, this pelvic bone is android. For some females, they have this kind of pelvis, which is narrow and can make it harder for the baby to move through the birth canal. We have also here the specific part of a pelvic bone. So as we can see here in the anatomy of the pelvic bone, the sacrum is opposite to the symphysis pubis, which is located on the buttocks part of a human. We have also the ilium, the scium, pubis, and the scalp spine, which is determinant if the baby is already engaged or not during labor, and a lot more of anatomy of the part of the pelvic bone. So let's dive into my topic. First, we have here the inlet contraction. So when we say inlet contraction, it is the narrowing of the anterior-posterior diameter of the pelvis to less than 11 cm or of the transverse diameter to 12 cm or less. So from the definition itself, ito ang pagliit ng sukat from front to back of the pelvis, which is from sacrum to the symphysis pubis. So its normal range is from 10 to 12 cm. So if the measurement of such is lower than the normal range, then it can have present challenges during labor and childbirth. So if you have narrow inlet pelvic, it can cause certain complications during labor, such as prolonged labor, fetal malposition, increased risk of C-section, because it will be hard for mother and child to go through natural labor if the mother has narrow pelvis. We have also assisted delivery, and lastly is the fetal distress. So this time I'll be discussing the factors affecting the pelvic that becomes narrow. So the pelvic that becomes narrow is caused by rickets. So when we say rickets, it is calcium lacking, or maybe at birth you have inherited small pelvis from your parents. So rickets can lead to deformities in the bones, including those of the pelvis. So the softened and weakened bones are more prone to deformities as they grow. Rickets can cause widening of the pelvic girdle due to the softening and deformities of the pelvic bones. So this widening is a consequence of the abnormal growth patterns associated with the condition. So it would be hard for you if you become pregnant. No, it will be hard for you to undergo or to go through the natural labor. So it would be the best if you will go for cesarean section. Every primigravida should have pelvic measurements taken and recorded before 24 weeks of pregnancy, so that the nurse should know if there is any complication that will arise during labor. They can have early intervention to prevent such a situation. So if there is cephalopelvic disproportion or CPD, when we say CPD, it is a pregnancy complication in which there is a size mismatch between the mother's pelvis and the fetus head. So for example, mas malaki yung head ng baby kaysa sa dadaanan niya or passageway niya, which is yung pelvis ng ina niya. So it would be hard for the fetus to go through the passage. So of course, so fetus may not engage but remains floating. Consider the possibility of cord prolapse. So when we say cord prolapse is mauuna lumabas yung cord ng baby kaysa sa presenting part of the baby, and it would be dangerous for the baby kasi maaari siyang magdudulot ng certain complication. So next, my topic next is all about outlet contraction. So when we say outlet contraction, it is the narrowing of the transverse diameter. So it is the distance between the ischial tuberosities at the outlet. So to less than 11 cm. If the inlet contraction is ang anterior-posterior diameter niya is maliit, here in outlet contraction, the transverse lie of the pelvis becomes narrow, or the side-to-side diameter of the pelvic is narrowing. So it is rare but should be diagnosed during prenatal checkup so that the nurse can early address the situation. So we can have X-ray pelvimetry. It can be done to ensure accurate findings or measurement of outlet pelvis, or is it capable of what do we call this one? If So we can have management during it can be delivered through normal spontaneous delivery or NSD. So and cesarean section. However, CS or cesarean section is the best management in delivering the baby to avoid any harm such as fetal distress. So NSD or normal spontaneous delivery can be done but depends upon the situation of the patient pelvis. So let's go to my third and last topic. So we have here the external cephalic version or ECV. So it is a medical procedure performed during pregnancy to manually turn a breech baby one positioned feet or buttocks first, or the presenting part is the buttocks or the feet part. So into a head down position for a safer vaginal delivery. So if the baby ang presenting part is ang buttocks, dito na-apply ang external cephalic version kasi tinuturn yung baby para maging cephalic position siya, which means na ang head yung mauuna instead na feet kasi yon nagmaneuver yung nurse. So ginagawa ito para maging safer ang delivery. So this procedure is typically attempted after 37 weeks of gestation, but there are specific reasons why it may be done earlier, around 34 or 35 weeks. So we have different positions here. First is the cephalic, which is ang presenting part is ang head. We have here the breech. We have the oblique, which is diagonal position yung baby, and we have the transverse, which is horizontal position yung baby. So, external cephalic version or ECV is typically considered for pregnancies with a breech presentation, and it is usually attempted closer to the due date when the baby has less room to move on its own. So the decision to perform ECV depends on various factors, and healthcare providers carefully evaluate each case to ensure the safety and well-being of both the mother and the baby. So, again, this is done only for breech presentation sa fetus para mas maging safe yung delivery nila, para mauna yung head kasi kapag mauuna yung head na lumabas, it would be kapag mauuna yung head is continuous na yung paglabas. Unlike sa feet, kung mauna ang feet, it would be hard kasi maliit yung first na lumabas, which is ang feet, and then followed yung head na malaki. So, that's it. So, ECV is conducted when fetus is in a breech or even in transverse position, so which may complicate the delivery process. So breech presentation occurs in about 3 to 4% of full-term pregnancies. ECV is typically attempted after 37 weeks of gestation. The healthcare provider uses their hands on the mother's abdomen to gently maneuver the baby into a head down position, or also known as, for medical term, Cephalic. So the procedure is often done under ultrasound guidance to ensure the safety of both the mother and the baby. For independent procedure, monitoring and recording of fetal heart tone and UTC, or also known as ultrasonography result, both are crucial for ensuring the safety and well-being of both and the mother and the baby. So, monitoring for fetal distress, visualization of fetal position, guidance for maneuvers. So, we have here the for dependent procedure. They can take tocolytic, which is a drug to relax the uterus from any contraction that may happen during the maneuver. So, although not always successful, but can decrease the number of CS or CS mothers. So, pwede sila normal delivery when na-turn na yung baby into a cephalic position. There are also considerations of not doing external cephalic version due to some factors such as multiple gestation, small pelvic diameters which nurse cannot maneuver or manipulate kasi nga maliit yung pelvic during the growth of the mother. Truly, because they can't have normal delivery and is subject for cesarean. So next factor is unexpected third trimester bleeding and many more. So I think that would be all for my report. Thank you so much for bearing with me all throughout the video. I do hope you learned something new.